second. Just some housekeeping before we get started. So you'll see that we've just put up a recording request. You will not be visible because it's a webinar format, so there's no troubles there, and we will distribute the recording link to those that were not able to join us today so that they can hear the information presented as well. So just noting that this session will be recorded. Also, we are in a webinar format, as I mentioned, which means that we will be able to engage in a few different interactive ways. And you can use the chat on your screen. You can use the Q&A function when we come to question time. And we're also going to be using Mentimeter, which we'll go through in a sec, just to gauge your thoughts and feedback on some different questions throughout. So we will be hearing from you, just not in a traditional meeting sense. So thank you for joining today, and we will formally get started. My name is Sarah Judd-Lamb, and I'm the Executive Manager, Policy Development and Research at Carers New South Wales. I'm pleased to be hosting this launch today of the Young Carer Inclusion Network. I'll ask the team to please go to our next slide. So it's important that we acknowledge country in starting the session today, and I want to acknowledge traditional custodians of the land that my team is delivering this webinar from today, which is the lands of the Gorogal people of the Eora Nation. But I also want to extend respects to elders past and present in all of the lands that are represented by those of you joining today from across New South Wales. And we also want to acknowledge the important role that carers play in Aboriginal and Torres Strait Islander communities, and particularly the higher prevalence of young carers in those communities. We can go to the next slide, please. Carers New South Wales, if you're not familiar with us, is a peak non-government organisation, and we support family and friend carers in New South Wales. So there's just some points there about our goals and vision. But what we are mainly talking about today is young carers, and that's an important focus of our work. I'll just go to the next slide, please. We are going to go through a few different bits of information today. We're going to try and keep it short so that we can finish at 12:30 and not take too much of your lunch break. We will, I think, move in a sec to some Mentimeter interaction and tell you how that will work today. But just as a bit of an overview, so you know what we're going to be talking about, we'll just start off with some background information about young carers so that everybody's on the same page. We'll give you a little bit of information about how the Young Carer Inclusion Network fits into Carers New South Wales' existing young carer activities. And then we'll go into really the key important information about the network, what's in it for you, what involvement will be including, and then kind of action points, what to do next. And we will also have some opportunity for questions at the end of the session in case there's anything you'd like to ask. So if any questions or comments come up throughout, please feel free to post those in the chat or the Q&A function, and we'll keep an eye on those, but we'll address them towards the end of the webinar. Thanks, Sarah. Next slide, please. So before we get into the content, what I would like everybody to do, if they can, is to use the information that's on the slide or in the chat to join the Mentimeter questions. So some of you may have done this before, others it may be new for. If you can visit that website, www.menti.com, you can use the link, you can use the QR code, however you want to get there. You can do it on the device that you're joining from, if you prefer, in a different browser tab online, or you can use it on your phone or other device in front of you. So if everybody can just find that website, enter that code, and prep to respond to some questions. We're just going to get some interaction from the audience to just understand who we've got here today, where everyone's coming from, and we'll also use that later to collect some feedback from you. So hopefully that is all working. If you're having trouble, please send us a note in the chat. I can see we've got some thumbs up coming through, which is excellent. So our first question is just getting a sense of, I guess, your background in terms of young carers. So if you're in the Menti, and again, the link and the numbers are up there, could you just let us know which of these groups best describes you? So which of you are sort of working with children, young adults, if you are a young carer, if you know a young carer, or if you're completely new to this space, there's no correct answer. We want people from all backgrounds, but it's just great to kind of get a feel for who we've got present today. So you'll see those answers coming up on the screen now. A great mix, which is excellent. Thank you for completing those. And again, if you're having trouble, please post in the chat. So great response rate so far. So we've had nearly everyone respond, I think, and we can see there that we've got most people today are working with children and young adults, which is perfect because that is the target audience of this webinar and this initiative. So that's fantastic. But it's also important to see there that we have some people who personally are young carers or know young carers, perhaps in or related to their professional work or just in their personal capacity. And importantly, we've got some new players who have not really reflected much on young carers before. So that's excellent. And it gives us an idea of, I guess, who we're speaking to today. And I can confirm that you're all in the right place. So thank you for joining us. We might move on to our next Mentimeter question since everyone's got the hang of that now. If you are working with children and young adults, what sector is that in? So hopefully those categories cover most of you. But if not, there is an other. So I'll just give you a moment to respond to that as well. And hopefully we've got a reasonable spread. Quite a lot from health, which is great, education, mental health, some youth services sector. So just pop in the one that best reflects your professional background and current work, if that applies to you. Those that are not working in the sectors listed, that's fine, you can hold off. So it looks like we've got mostly health and youth services sector, which is great, but also some education and mental health as well. So we will talk about, I guess, how the sectors play into this project throughout the slides. If you're in an other sector, could you just pop in the chat which sector that is, just so we can capture that? That would be fantastic. And we might go back to the slides now while we do that. So thanks again for letting us know what perspective you're coming from today. So getting back to our slides, we are going to just give some background on young carers. So many of you will be aware of this, but particularly for those that are not aware, young carers are children and young people under the age of 25 years. And young carers are people that are providing support to a family member or friend that relies on them for care. And there's a few different conditions listed there. But basically, any child or young person who is involved in supporting a family member or friend that relies on them for that support. And it's just important to note that when we talk about young carers, we're not talking about people that are paid for that role. We're not talking about people that are in a formal volunteer or placement role in a sort of professional capacity or a sort of civic capacity. And we're not talking about people that are, say, a parent of a child that does not have any sort of atypical developmental needs, or a sort of foster carer or a kinship carer that is not caring for someone with the conditions listed above. So that's just kind of a bit of a definition for you about young carers and who we're talking about. We can go to the next slide, please. Based on that definition, we have a bit of data. The data could be stronger. There's some gaps in it, but from what we do know, there are at least 83,700 young carers in New South Wales. So that's a lot. And quite a few of those are primary carers, or the person that is providing the most support to a person. So often we see that young carers provide support as part of a team. So perhaps as a sibling alongside their parents, or with a parent alongside another parent, or with the family for a grandparent. So there's often, young carers are often part of a caring team, which means they can be hidden or not seen. But there are also, more than 1 in 10 young carers are primary carers. So it's important to note that they often take a lot of responsibility in the caring role. About evenly split in gender from the information that we have available. We have quite a high prevalence of young carers outside of major cities, which is important. And we also have a reasonably high prevalence compared to the population in culturally and linguistically diverse backgrounds and Aboriginal and Torres Strait Islander backgrounds. And a key kind of factoid that we draw to kind of make this real for particularly our education stakeholders is that there's at least one young carer in every classroom. So it's a it's a principle that's important to keep in mind, is that if you are working with children and young people in any capacity, education or elsewhere, there will be at least one young carer that you've encountered. You may just not be aware of that. And so that really makes the foundation for what we're presenting to you today, the Young Carer Inclusion Network. So we can go to the next slide, please. And thank you for putting those sectors in the chat so we can capture those. So I mentioned hidden before. Many young carers are hidden in that they either don't recognise their caring role themselves and don't realise that what they're doing is any different from what other people do in their family systems, or they might realise that they are, but not be recognised as such by those around them. And sometimes that's because they actively don't want to disclose that role because they might be concerned about intervention or stigma. So we often refer to young carers as hidden for that reason. And so that means that, again, you're probably encountering lots of young carers in your work. They might not be aware that they're young carers. You might not be aware that they're young carers. There's just some quotes there about reflections from young carers about how that works for them and why they might remain hidden. And so I guess an important question in this context is, why is it important, or is it important for us to address that? And I guess the reason to address it is that if young carers go without recognising their caring role and being recognised by others and being provided with support for that caring role, that can really impact their educational, employment, wellbeing outcomes. And so one of the things that Carers New South Wales is committed to is trying to raise awareness of young carers so that more young carers can be identified, so that they can be linked with support, and hopefully their outcomes are improved as a result of that. We can go to the next slide, please. So just for some background, the Carers New South Wales Young Carer Program, which is coordinating the Young Carer Inclusion Network, has a whole number of initiatives that are focused on raising awareness of young carers, improving practice among the key sectors that we talked about, engaging with young carers' lived experiences. So you can see that the Young Carer Inclusion Network at the bottom there is just one new initiative in a range of initiatives. And the one above that in purple, the Young Carer Hub, is another exciting new initiative that will be launching soon. And all of this will be much more highly featured and clearly featured on that hub as well. So just as a bit of an overview, the Young Carer program at Carers New South Wales delivers awareness training to service providers and educators. So if any of you present today are interested in that and have not accessed it, that's something we can readily deliver to you as soon as possible. It's ready to go. We have a newsletter that goes to young carers, parents, service providers, educators and other professionals as well on a monthly basis. We have an advisory group made up of young carers that informs Carers New South Wales broader activities and young carer specific activities. We recently completed the first season of a podcast that is really around raising awareness of young carers to support people to identify themselves as young carers and others as young carers. And like I said, the Young Carer Hub and the Young Carer Inclusion Network are two big new initiatives under the New South Wales Carers strategy that we are working on at the moment. So if we can go to the next slide. The New South Wales Carers strategy, if you're not familiar with it, is a 10-year whole of government plan that's really focused on recognition and support of carers. It's the second carers strategy in New South Wales, and Carers New South Wales is lead and partner on a number of projects with different departments of the New South Wales government. And the second action plan was recently released, which covers the next 2 years. And one of the key new projects under that Carers New South Wales is leading is the Young Carer Inclusion Network. So that's where it comes from. It's part of that broader strategy. We can go to the next slide, please. So in terms of the actual network itself, now we're getting to the crux of the webinar, what it is, why get involved, and next steps. So the Young Carer Inclusion Network, its overarching goal is to improve the identification and support of young carers in New South Wales. So as I mentioned before, a lot of young carers are not identified. Identification allows them to access support, which improves their outcomes. So really, we called this a Young Carer Inclusion Network because we want young carers to be more actively included across the community and across different services. But the way that we see that happening is through identification and support. There's 3 key objectives to this network. And these are kind of, I guess, will be reflected a little bit in the activities of the network as well and how Carers New South Wales leads it. The first is identifying gaps in mainstream service sectors those sectors we mentioned before. So we want to start by looking at, what are the specific issues around young carer inclusion, identification and support in health, education, youth services, mental health, all those different settings. Second objective is to, where there are gaps, help build the capacity of professionals and service providers, like many of you today, to identify young carers. So, we do this day in, day out. And so how can we apply that knowledge that we have and the resources that we have to your sectors to help strengthen those opportunities to work with young carers? And finally, streamlining access to support for young carers that are identified in mainstream service settings. So when you identify a young carer in your sector, obviously you may want to tailor how you respond to that young person in the context that you've identified them in. So if it's in school or if it's in a health service, there's many things you can do to support them with that knowledge in your setting. But there's also a lot of young carer specific supports that exist that you can refer those young carers to. That's something also that we want to help improve referral from all of your settings as well. So that's the broad purpose and objectives of the Young Carer Inclusion Network, and hopefully they resonate with you if you're here today. If we can go to the next slide. Anticipated outcomes. So what are we hoping to achieve with this project, working with you and others in the next 2 years? We want to see greater awareness among professionals and service providers that are working with young people about who young carers are and what challenges they experience. We want sector-wide improvement in confidence among professionals and service providers to be able to identify young carers and know how to address the challenges that they present. We want a key result to be tailored and visible support for young carers in more mainstream service settings. So just seeing more young carer responses tailored to young carers in different service settings that you're part of. And ultimately as well, we just want young carers, wherever they're engaging in services, education, health, otherwise, to be comfortable with actually disclosing their caring role, with asking for support, feel that they can actually do that in more mainstream service settings and not just kind of in the carer support sector. So that's our anticipated outcomes. If we can go to the next slide, please. So who can participate in this? I've already said, based on your responses earlier, it sounds like all of you are part of our target audience. Really anyone that is working with or interacting with young people in a professional context or service setting in New South Wales that wants to improve in this area and contribute to sector capability improvement in this area. And so we want to particularly have people from settings that are not specifically geared to young carer support, but settings where young carers definitely are appearing. That's why we've called out education, health, mental health and youth services, because these are settings that are not specifically geared to young carer support, but where we think that there's lots of potential to better identify young carers and connect them with that young carer support. So if you are a professional or a service provider that engages with young people and is interested in learning more, that's you. We also don't want to exclude young carers themselves, and there is going to be opportunities for young carers to participate in this process in sharing their lived experience, both in sort of a reference group function that we're going to be developing, but also through meetings and actually helping us to communicate with professionals. But ultimately, we're working with professionals to improve their practice through this network. Next slide, please. So why participate? Hopefully, you've got a good idea of that already, but really, I can guarantee that all of you have engaged with young carers and will engage with young carers, even if you're not aware of it. And so we just want to make sure collectively that those young carers are lined up with the supports that are right for them to help them succeed. And so I believe our next slides are more about the practicalities of how we're going to do that. And we might come back to some more Mentimeter questions as well. So if we can go to the next slide, that would be great. So practically, what does participation involve? So this is a network that's going to have about 3 meetings a year. They're going to be online meetings via Microsoft Teams, but we want to host them from various locations so that we can feature different work that's happening around the state. So that's why we've called them hybrid meetings, but basically you can participate online in all of these meetings, and we've scheduled 3 per year, per financial year. And the kinds of things that are on this, it's not a traditional interagency in terms of just being info share. We want to bring in training that Carers New South Wales can deliver to you based on topics of interest and areas of challenge to help build your awareness and improve your practice around young carer support. But we want to provide opportunities for your services and teams to actually share their learnings, things they're trying, things they think they're doing well that would support others to implement similar measures. And we also want to make sure we're embedding young carers' voices so that we can all learn from that. And we will be really actively working with this network to co-develop new resources and training and to really get to the bottom of some key challenges that are experienced in practice working with young carers. So we're bringing our knowledge, connections, expertise, but we're really going to draw on those last 2 points there, participants' own insights from their own work, their networks, their colleagues, and their expertise and contacts to really just try and build practice in this area. So there'll be active meetings and we're really looking forward to having a whole range of different people involved and hopefully you'll be able to learn something, share something and really relate this to your work and your KPIs. So we'll have, like I said, 3 meetings a year. On the alternate month, we'll send an email update with new initiatives, new resources, and there'll be an opportunity to share work of the network as well through that. But if you would like to put the Mentimeter up, we just wanted to kind of gauge from people listening today. I know not everyone will maybe be ready to sign on, but we will be doing the first formal meeting of the network in September. And we wanted to kind of get a sense of people's interest and availability. And we will come back to you around this if you haven't got your calendar in front of you. But if you're keen and you've got your calendar there, which of those dates is looking better for you? Just your own working days, your other meeting commitments. So yeah, feel free to just kind of have a bit of a look at that and respond. And for that first meeting in September as well, we will be looking at topics that are of interest to the group. We'll be looking at the main sectors that are represented. We'll be actually looking at kind of a bit of a work plan for what can we develop with you to be most useful for your sector. So there'll be a lot of opportunity at that first meeting to really help shape, the subsequent meetings as well in terms of how the project takes place. So got some responses coming in for that. That's great. So we might flip back to the slides and we'll use that information to sort of plan our next steps. Just want to make sure we wrap up the webinar content in time for some questions. So what's in it for you? We know that everybody is very busy, especially in some of these key sectors that have been hard hit by COVID and are still recovering. But we want to make sure that this is not only achieving the goals that we set out, but like really, really relevant and useful for your practice. And so we're designing it like that, and we will tweak it as we go to ensure that that is the case. We want you to be able to get new knowledge, skills, and contacts to support your work, be able to contribute to tools that you will use in your work, be able to share and highlight your own achievements, and make new connections with people that are interested in similar things, and really just to contribute to broader awareness of young carers and have your own sector and organisation recognised as taking strides in that direction. So we do feel that there's a lot in this for you, but we hope that you see that as well. And we will collect some of that information from you as we kind of officially connect as well. We can go to the next slide, please. So where to from here? We have a form which kind of captures some key details about you, your sector, what you're hoping to achieve from being involved. You can reach that by the QR code there. We'll also share the link, I think, in the chat. Yep, thank you, Sarah. And be sharing this ongoing as we broaden the reach. So you're welcome to share this with others, colleagues and networks that are interested. So if you're sitting here thinking, definitely want to do this, I'm keen, please do complete that form so that we can kind of officially include you in updates about upcoming meetings and opportunities. And we will be in touch in the coming weeks to sort of keep you updated. So we'll leave that link in the chat for now. And we might just move to, is that our final slide? Cool. So our last slide is speaking to Mentimeter. So what I might do is we'll put, we've got a couple of questions on Mentimeter that are just broad. So we might let you Might get those questions rolling just to collect your thoughts. If there's any reflections that have come through from this webinar that you wanted to add that we should keep in mind, prioritise as part of this project, we will maybe just leave those open and you can kind of be responding. And while we run through those in the last couple of minutes, I also just wanted to open up to questions. So if you have a question about anything we've talked about today or about the network, please feel free to post in the chat or in the Q&A function. And in the last couple of minutes, we can address those and also wrap up. So for those with Mentimeter in front of them, there's just an opportunity now to kind of make suggestions on your areas of focus or priority. So feel free to respond to that if you've got any particular thoughts on it. Are there any questions for me or for us before we finish the webinar? Feel free to pop those in the chat if there are. Nothing there so far. Hopefully it's all very clear then. And we will maybe just go back to the slide with the contact details, just so that people have that as a place to end on. If you do have any questions that weren't answered today, or if you're looking at that information and you're looking at the form and you're thinking, I might be interested in this, but I'm just not sure that I can definitely commit at this stage, or I'd like to know a little bit more, or I need to make a case to my manager, or I need to look at how it fits in with my KPIs. If you're a bit on the fence still, that is completely fine. We do have the email and phone details there, which you're welcome to check in about, and we'll just have a chat with you about what we're doing and how it fits with your own priorities. So we really encourage you to get in touch if you're not sure yet. But if you are sure, please do lock in that form so we can progress this project. So thank you very much for joining today. I hope you learned something about the network, and I look forward to engaging with many of